Brittany, the state of Utah has spent more than $100 million responding to the COVID-19 pandemic. And some of the state's orders and controversial contracts have raised some questions about how they've decided to spend the money. State officials meeting today with the media, but did not allow cameras in that meeting. They did tell ABC4 News investigator Jason Wynn afterward if they made mistakes, it's because those decisions needed to be made quickly.
Since the COVID-19 pandemic hit Utah, the state has spent $108 million, nearly $94 million spent on COVID-19 response and roughly $14 million on the economic response.
You know, our hope is, though, that we haven't wasted any taxpayer dollars, federal or state. We're in hopes that this is, you know, the optimal would be that we would just be completely even keel at the end of this thing.
State officials say they acted quickly on hydroxychloroquine because the feds put 53 million doses in their stockpile, gathering up what they could.
If we, as Utah, if this does really work and we don't get just a small amount of this, we're going to be in trouble.
The state was refunded $800,000 for the purchase last month from Meds in Motion. State officials say they got the remdesivir from Health and Human Services. They hope this drug will work out great.
We received 10 packs, which will treat up to 50 people.
The governor's Office of Management and Budget spent $10 million on COVID-19 contracts. The contracts total $23 million, most ending on May 31st. Executive Director Chris Cox tells me a lot of the money went to software developers to build infrastructure around healthcare to actively test and trace COVID-19. She says those contracts are currently under review, and all new contracts will be conducted through Unified Command.
If there's a peak in the fall, these local suppliers will be able to meet that demand.
Chris Hughes, the state director of purchasing and general services, found a reason to buy local.
We were able to source face shields, face masks, gowns, reusable gowns. All of the items that we were looking for, we were eventually able to find locally.
More than $55 million was spent on local PPE providers, allowing the state to distribute the PPE to hospitals and first responders, possibly positioning Utah well if there's a spike in the fall. In Salt Lake City, I'm Jason Wynn, ABC4 News.